Good evening. The subject of our case study this evening is a 54-year-old female who presents to her primary care physician's office with symptoms of what she feels is bronchitis. This patient is experiencing chronic persistent cough, chest pain. She's also having shortness of breath, and she's also experiencing a small amount of blood-tinged sputum. She attributes the chest pain to the persistent cough that she's been experiencing. However, this patient has a history of being diagnosed with bronchitis 2 to 3 times every year for the past 10 years. She's been diagnosed with pneumonia, bacterial pneumonia, 3 to 4 times in her lifespan. This patient has a history of smoking cigarettes, 3 packs a day, for 30 plus years, although she has quit smoking for the past 3 years. With this history, the primary care physician does suspect the possibility of lung cancer, because the pathophysiology of lung cancer is created by the means of repetitive irritants in the lungs that create changes and cause abnormal growth and overgrowth of cells, creating tumors. And this is according to Farron Siddiqui in an article in 2019 on lung cancer pathophysiology. So the initial testing that a primary care physician orders is a chest x-ray. That's the first line testing for ruling out pneumonia, any type of tumors, bronchitis, pneumothorax, or anything like that. So the primary care physician does ask that the patient stay to get the results. The patient does get the results, and a 4-centimeter mass is noted in the branching of the 2 bronchi, right at the branching. So the primary care physician does call a local pulmonologist and ask for a pulmonologist to see the patient. The patient does get in to see the pulmonologist. The pulmonologist in turn does schedule a bronchoscopy so that a biopsy can be taken. A biopsy is taken, so a sample of the tissue can be tested to see what type of cells that are in the mass. Now, according to Sophie Chang and Catherine Brown, both MDs, in their article on lung cancer staging, confirmation and typing can be done with a bronchoscopy and with a biopsy, but staging can only be done by CT and MRI because of the detailed pictures and images that can be done, where they can actually see the details and how far the tumors have grown, what places they've gone to, and what parts of the body that they've gone to. Through these tests, it was confirmed that it was non-small cell lung cancer, and it was stage 3A. Now, the first line treatment for stage 3A lung cancer, according to Winston Tan, MD, is surgical removal, followed by chemotherapy, followed by radiation. However, because of the location of the tumor, surgical removal was not going to be possible. When surgical removal is not possible, the prognosis becomes, for a 5-year survival rate, becomes a lot less. a 5-year survival rate with surgery followed by um, chemotherapy and radiation is 63% of 5-year survival rate. When you take out the surgical removal with just the radiation and chemotherapy, it becomes 19% in an article in 2016 on 5-year survival rate among stage 3 lung cancer patients receiving 2 different treatment modalities. So when someone gets a diagnosis like this, one can only know that it becomes, your world gets turned upside down. Your life is no longer as you know it or as you knew it. So there becomes a knowledge deficit in many areas of your life. You don't know where to go. You don't know what to turn, where to turn. You don't know how to function anymore. So the job of the nurse then turns to education. The biggest piece a nurse can do at this point, you can't always fix everything as a nurse. But the most important thing that you can do is educate your patient on the process and the processes and what they need to expect out of what's going to come next, what they need to expect in treatment, what they need to expect in the disease process, what's going to be happening, what their body is going to be going through. So education is the utmost importance. So when you're talking about radiation, you want to be explaining to your patient that radiation in the area that you're receiving it is probably going to get really tender. It could be excoriated. And where we might want to put lotion to soothe those areas, or we may want to treat those things, it's not necessarily something that we want to do, not unless our doctor prescribes something specific for us to put in those areas. It may cause us to be tired. We may become weak, and the hair in those areas that we're having irradiated, we may lose that. Those are some things that may happen during radiation. It may cause us to have some body image issues. We're also going to need to speak to our patients' emotional issues, and they may need some spiritual guidance, and we need to meet them where they are and have them guide us and what they need. So when we're talking about chemotherapy, we also need to let them know that it's not like radiation. Unlike radiation, chemotherapy is not every day or every other day. It may be every 2 to 3 weeks. Radiation is a beam, so to speak, on our body. Chemotherapy is actually going to go into our system, go into their veins. It's going to go through their bloodstream. It's going to be something that is going to cause them to be weak, so somewhat like radiation, but it's going to cause their white blood cells, their immune system to get lower, which may cause them to get sick a lot easier, which may change their shopping habits. It may change the way they go meet family. It may cause them to stay at home more often. It may keep them more homebound, because if you are more prone to getting ill, you're not going to want to go out in crowds, because you don't know who's carrying germs, and you don't want to risk getting sick because you already don't feel good. So those 2 to 3 weeks in between your treatments, your body needs to build itself back up. And during those time frames, you may be sick at your stomach and not want to eat. You may just be nauseated and tired, and sometimes chemotherapy makes you feel that way. But you want to try your best to eat a diet rich in fruits and vegetables to get your strength back. You want to drink an adequate amount of fluids so you can flush those things out of your system, so that you can get the toxins out of your system as quickly as you possibly can, so you can get back to your original feeling of good health. You also want to make sure that you stay away from any lung irritants, anyone's secondhand smoke, any other irritants out in the open. I know that I really hate getting behind school buses in the morning because it really chokes me. So just things like that about how you change your daily activities. And some of those things are going to be difficult to change in your life. So these things are going to be life-changing. And in these things, you are going to find that life is going to be different. But it doesn't have to be bad. And you're going to find that you're going to have a lot of questions, and no question is a bad question. And no question is a dumb question. And you need to ask as many questions as you can to the nurse that you have. And you need to know that that is your advocate. Your nurse is there to help you heal. And your nurse is there to give you the answers to the best of her ability or his ability. And that's what they're there for.